Today is Saturday, December 3rd. It's been called a tripledemic, as in 3 viruses surging during a pandemic. Experts are keeping their eye on high levels of flu in more than half of the states, new variants of COVID-19, and a recent surge of RSV. Today, you'll hear from a pediatric infectious disease specialist all about RSV, including what parents need to know and why it seems so different this year. But first, I'm joined by data scientist Dr. Caitlin Jetelina, who you may know on social media as your local epidemiologist. She works in health policy at the Meadows Institute and is a senior scientific advisor for several nonprofit and government agencies. We'll get into what the data shows about how effective the latest COVID boosters are, what she's watching for as flu season ramps up, and her advice for balancing family and health this holiday season. Welcome to the Newsworthy Special Edition Saturday, when we sit down with a different expert or celebrity every Saturday to talk about something in the news. Don't forget to tune in every Monday through Friday for our regular episodes, where we provide all the day's news in 10 minutes. I'm Erica Mandy. It's now time for today's Special Edition Saturday. Dr. Caitlin Jetelina, thank you for coming on the Newsworthy again.
Thank you for having me. I'm excited to be here.
So there have been a lot of headlines and some concern about a so-called triple pandemic this winter because we have COVID-19, the flu, and RSV. Break this down for us. Why is this year different from years past, and why do we feel like we're seeing such a surge?
Every winter during the pandemic has been unique, and with it, really unique challenges, right? Our first winter, we didn't really have vaccines. We didn't really know much about SARS-CoV-2. Our second winter was the dreaded Omicron wave, and now it's our third winter where our normal viruses are back. And so we are trying to see what this new world looks like with COVID-19. And, I think there's a lot of hypotheses of why flu and RSV have been low the past 2 years and now are skyrocketing up. But bottom line is they are back. RSV is surging, flu is on its way, and COVID is kind of still there in the background.
What are you seeing right now with the flu season? And what does that tell you about what to expect for the rest of the winter when it comes specifically to the flu?
Flu activity is increasing incredibly quickly. It is earlier this year, and it's also steeper this year than we've seen previous years. But we don't know if this is really going to be a quote unquote bad flu season. It's, like I said, it's earlier and steeper, but are we just going to peak earlier than before, or is this really a warning sign of what's to come about our peak in January, which is going to just throw all records away? We don't know. We also don't know how severe it will be, right? So cases are increasing and hospitalizations are increasing, but hospitalizations are nowhere close to previous flu seasons yet. So we kind of just have to watch.
And what about COVID-19? I know after Thanksgiving, I know some people, or actually during and after Thanksgiving, I already know some people who have gotten COVID-19. Are we starting to see those cases rise? Or do we really even know since everyone's taking those home tests?
We're recording this about exactly a week after Thanksgiving, and hospitalizations for those over 70 have already started increasing incredibly quickly.
What do we know about the newest variants that are now dominant in the United States?
It's an interesting part of the pandemic because there's more than 500 subvariants circulating across the globe. And we basically have this variant soup. Right now in the United States, BQ1 is taken over. It's over 50% prevalent. We thought we should have seen a wave by now by BQ1, and we just haven't. And so this has caused a lot of questions of why. And we may be moving away from this one dominant strain to multiple dominant strains, depending on geography. We just kind of have to see how this plays out.
The updated COVID-19 booster shot became available in September. Right now, I think the last I checked, it was only about 11% of eligible Americans have actually gotten it. Why do you think there is the slow uptake? And what do you say to people who maybe feel they aren't necessary because they've already had COVID-19 or something like that?
It is a disappointing uptake, and I think there's a couple things causing it. One is pandemic fatigue. People are just done with COVID. I think that there's been suboptimal messaging from the top about needing a booster. And I think there's a lot of confusion and access issues as well. And so all of those are creating this perfect storm of low booster rates. But I think there's a large majority of people delaying their booster shot because they were infected during, for example, the BA.5 wave. And I think that's the right call, that you should wait a couple of months after initial infection to get your booster so it works even better.
Can you speak to how effective they are and how that plays into people's decisions?
So right now we have quite a few lab data, and the purpose of the fall booster was really threefold. One, increased protection right now, and we know that works. It increases our neutralizing antibodies. It will help prevent infection, at least in the short term, maybe a month or two. Not perfect, but it'll help. The second purpose of this booster is durability. We want it to last longer than our original vaccine. We do have seen data from other previous clinical trials, like the beta vaccine, that it will last longer. So we're hopeful, but we're at the mercy of time to see that data. The third purpose of the vaccine was broader immunity. So, for example, can we train our antibodies to recognize more parts of the virus than the original one, because the virus has changed substantially? The challenge is that we only have lab data, and lab data is very different than real-world data, epidemiological data, effectiveness data. And we just don't have effectiveness data yet. And I think a lot of people are waiting to see that.
Thanksgiving has come and gone, but we have the December holidays coming up soon. What's your advice for people about those gatherings and how to keep themselves and their families healthy while maybe still celebrating if they want to? How do you advise people to try to find that balance?
Yeah, I think that people, need to try and understand what their goal is, right? So with prevention, one big goal of mine is to protect the very vulnerable from severe disease. That means grandparents, that means great-grandparents, and trying to break as many transmission chains before we see them so we don't bring the virus to them. So to me, that means wearing a mask very vigilantly 1 week before, right? In grocery stores, picking up my girls at daycare. And that will help prevent me bringing the virus to them. Taking an antigen test that morning or a few antigen tests that week will also help pick up asymptomatic transmission. And staying home if you're sick. I know it sucks, but it's literally one of the best things you can do for your high-risk people at the holiday.
Any final thought or takeaway?
I think that this upcoming winter and how we fare in the United States and around the globe will tell us a lot in where we are in this pandemic, if we are truly still in an emergency or if we are getting much closer to endemic. Time will tell, but we need to be patient and still be careful around our loved ones.
Still to come, RSV is a common virus. So why is it causing such a problem this year? And if your child gets sick, what symptoms would warrant a trip to the ER? Next, I'm joined by Dr. Sara Vora, a pediatric infectious disease specialist at Seattle Children's Hospital. But first, let's take a quick break to thank our sponsors. The Newsworthy is brought to you by CanvasPrints.com. If you are not sure what to get someone on your list this holiday season, CanvasPrints.com is such a great option to give something personal and meaningful, but also not too crazy expensive or time-consuming. Canvas prints start at less than $11 for an 8x8 print, and then canvas sizes can go up to 60 by 60. Or put a photo memory on a mug, starting at just $11.99. There are so many options that will feel personal and unique. And get something for yourself like I did. I'm so impressed by the big, beautiful wall display that I ordered showing off our family, and I can't believe how easy and quick it was to put in the order and receive it. Plus, right now, CanvasPrints.com has a special offer just for our listeners. Go to CanvasPrints.com and use the code Newsworthy25 to get 25% off your entire order of canvas prints, canvas wall displays, metal prints, photo tiles, photo blankets and pillows, and much more. Find the perfect holiday gift for everyone on your list and save with this amazing offer. That's CanvasPrints.com and use the code Newsworthy25 for 25% off your entire order. And this episode is also brought to you by BetterHelp. Ever been through a big life change and wish you had a user manual to help you navigate it all? I know I have. I remember starting this very podcast and business, and the first year or two especially came with a lot of uncertainty. Well, now I'm navigating parenting for the first time. And while friends, family, or the internet may be well-intentioned, sometimes you need a professional to say the thing you actually need to hear. Whether it's a big transition in life or just a feeling that you're stuck or something else is bothering you, Therapists are trained to help you figure it all out in a way that's truly helpful. And as the world's largest therapy service, BetterHelp has matched 3 million people with professionally licensed and vetted therapists available 100% online. Plus, it's affordable. Just fill out a brief questionnaire to match with a therapist. If things aren't clicking, you can easily switch to a new therapist anytime. It couldn't be simpler. No waiting rooms, no traffic, no endless searching for the right therapist. Learn more and save 10% off your first month at betterhelp.com/newsworthy. That's betterhelp, HELP.com/newsworthy. Okay, now to our conversation with Dr. Sara Vora. Dr. Sara Vora, thank you for coming on the Newsworthy.
Yeah, you're welcome. Thank you for inviting me.
So first, can you just summarize what RSV is and how it typically impacts babies and young children?
Sure. So RSV is respiratory syncytial virus, and that's just a complicated name based on its mechanism of action, but really it's just one of the many, many viruses that cause the common cold in children and adults. And we have certainly known about RSV for a very long time. It's not a new phenomenon. And generally, it tends to most severely affect young children under the age of 2 and older adults as well.
So for most kids, it just looks like the common cold, but then for some, it's more severe.
For most children, it causes cold-like symptoms. It can cause something called bronchiolitis, which is kind of a bad cold with a croupy cough. A small percentage of young infants, especially preemie babies, babies with underlying heart and lung disease, in kind of those youngest infants, it can cause them to need some oxygen or have periods where they stop breathing for a few seconds, which sounds scary, but that's why a small fraction need the hospital.
So what's going on this year? Are we seeing more cases of RSV? Are they just more severe or what?
Kids who would have normally seen RSV have not seen it with all of the precautions that we've taken during the COVID pandemic with masking and kind of social distancing. And so younger children haven't had a chance to develop the immunity they would have by now. And so we're seeing RSV in a broader spread of ages. And I think that's part of the reason that we're seeing such volumes.
So is it fair to say that our immune systems are not, it's not that they work less, but because certain kids weren't exposed to it when they normally would have, more kids have less immunity to this specific virus this season?
That's right. So RSV is a virus that it's an infection that you can get over and over again in your life. You don't develop complete immunity to it when you're exposed for the first time, but you do develop partial immunity. And so with subsequent exposures, you get milder and milder illnesses to the point where you may just have the sniffles, for instance, as an adult with RSV. And so kind of with that lack of exposure over the last 2 to 3 years, I think more people are just getting more symptoms because their immune systems either don't recognize it or have kind of forgotten about it.
For kids who do get RSV or flu or COVID-19, at what point should a parent seek medical attention for their child? Are there specific signs that we should all be aware of that it's like, okay, it's time to go to the hospital?
Fevers can be part of any of these viruses. Some amount of fever for 2 or 3 days is not unexpected. If it's very high fevers for longer than 3 days or so, really, they should be evaluated.
High fever being?
Definitely over 101, but, kind of over 102, 103 is I think, more concerning, just to make sure nothing else is going on top of the viral infection. The other thing I would say is in terms of breathing, as long as the babies are breathing comfortably, you don't see their kind of ribs retracting, they're not breathing too fast. Those are kind of signs that they may need a little bit of help. And that's specifically with RSV. And then the last thing we think about is hydration. Are these children able to drink enough quantities to keep themselves hydrated? They may not be eating very much. That's okay, as long as they're taking formula or milk or fluids and making wet diapers, at least one every 8 hours.
And of course, this is on top of flu season and COVID-19 still going around. What are your thoughts on the impact of what some people have referred to as the tripledemic?
For the most part, it's the impact on the healthcare system. The hospitals, especially pediatric hospitals, are just seeing kind of this surge of patients. We certainly have been at capacity for weeks, and it feels like it's just not ending.
And what does that look like inside hospitals? Like, what does that mean?
I was just walking through the emergency room yesterday, and there were patients all over the lobby and in the hallways. And on the inpatient side, we have rooms that are normally single rooms that have been converted to double rooms. We have patients who are being treated in what would normally be what we call like treatment rooms, not meant for overnight stays. We have just very, very, very busy staff and nurses working very hard.
I know there's a lot of parents who are hesitant to get their children the COVID-19 vaccine or the booster, even if they're eligible. What do you say to them when they say, you said it yourself, that usually it's not severe in kids, so should I be getting this vaccine?
It's a logical question. I strongly encourage all parents to get their kids the COVID vaccine. It is safe. It works to prevent them from ending up in the hospital and from getting severe disease. And we know that severe COVID is not very common in kids, but it does happen. And there have been hundreds of pediatric deaths from COVID. And so my kids have gotten all of their doses that they can get, because I just don't want to risk the chance of my kids getting MIS-C, which is the inflammatory syndrome that can complicate COVID. I don't want the chance of them getting long COVID, and I certainly don't want them to miss days and days of school unnecessarily, because they've already been through enough of that.
Okay, so if somebody's convinced, can even young kids get the flu and COVID booster or vaccine at the same time?
Yes, absolutely. Kids as young as 6 months can get either vaccine, and they can get them at the same time.
Any final thought or final takeaway for us?
We have a lot of viruses happening right now. So just do your best to keep your kids safe with the things we know that work: hand washing, masking in crowded places, flu and COVID vaccines, keeping your kids home when they're not feeling well to protect others. We're really overwhelmed, I think, in our pediatric hospitals, and I'm sure the clinics and urgent cares as well. And so seeking care when you need it, the things we talked about, is really important. But otherwise, most kids will be okay. They're just going to need your love and care for a few days to get through it.
Well, thank you to both of our guests for sharing their insights and expertise with us today. Be sure to check out Dr. Caitlin Jetelina's newsletter on Substack and her social media channels, all under the name Your Local Epidemiologist. And you can read more about Dr. Sara Vora's medical research work. We have links in our episode notes. We'll, of course, keep you updated on the headlines impacting your health, along with the rest of the day's news to know in our regular weekday episodes. Our 10-minute news roundups are available every Monday through Friday morning. So we'll be back on Monday. Until then, have a great weekend.